So today we're going to be talking about how to do a self-distraction or a self-mobilization technique. I find this works really well for pretty much any joint in the lower body, ankle, knee, hip. It also works really good for low back if someone's having some low back issues and they've responded well to things like mechanical traction, or it just feels good to have someone pull your leg or hang upside down in an inversion table, anything like that you found that unloading your body gives you some relief. This is kind of a nice technique you can do yourself at home or in the gym and just really get some relief from that, because obviously we still want to work out, we want to stay active, but when symptoms get bad, we want something we can do to bring them back down. So what I'm going to do is I'm going to show the leg distraction technique with a band on the rig over here. So we've got, and it should be a pretty heavy band. You want something that's going to give you a good amount of pull. What I'm going to do here is I'm going to put my heel into the band, and then I'm going to figure 8 up over the top of my foot so that I don't really have to do anything to keep this band on my foot. It's going to hold position here, and I'm going to scoot myself really as far back as I can get to get a good pull through that leg. This works best if we're fairly relaxed. We're keeping this other leg kind of planted here so that if I do get a really strong pull, I don't slide or scrape my back on the floor. But then I'm actually going to lean back into just a lying down position, and I'm going to relax this leg and kind of just let the band do its thing. Can move it around a little bit. Different angles can help different people. If you want to open up like this right side of my body a little more, I can position myself that way. I can also kind of angle my body so that leg's sort of across, and get some pull more through the lateral side of my body here, depending on what feels good and what I'm trying to get done here. I can also do an intermittent technique, like if anyone's ever had mechanical traction, sometimes they'll use it in an on and off kind of fashion where it pulls and releases and pulls and releases. You can do something similar to that yourself, just laying back here and using a tilt of the pelvis. And I'm sort of just pressing my low back down into the floor. That gives me a little bit of pull. And then I'm relaxing away, and that takes some of the pressure off. I'm pushing a little bit through this leg, but I'm trying to keep this leg pretty relaxed if I can, the traction leg, so that we get full effect there. And I'm tilting, putting on some more tension, relaxing, taking the tension off. Obviously, for the purposes of this video, I'm keeping my head up and speaking to the camera, but we would want to be fairly relaxed otherwise. Arms on the floor and just doing that for a few minutes at a time. If it feels great to do it longer, do it longer. I mean, obviously this is it's a passive intervention. It's designed to get your symptoms down when you're flared up, in order to get you back to the things you want to do, get back to strengthening, being more mobile, more active, all of those. But it's a really good trick to have in your toolbox when the ankle, the knee, the hip and the back especially are feeling pretty flared up, and just to take that pressure off and move some fluid around the body, clear out inflammation. There's lots of different mechanisms at play there, but we're really just trying to unload the joints involved and get them feeling better so you can keep moving.